Tennessee Death Row Dogs, your local dog rescue nonprofit. Talkopolis, the social media TV network for your city.
Hey guys, Kane Harrison here. Welcome back to our very special series of Mommy Makeovers, proudly brought to you by the Plastic Surgery Centre of Nashville. We do have Dr. Gingrass and Dr. Haws back again to talk about this incredibly important subject. We're going to get a little bit more in depth, shall we say, into the topic now, and we'll talk about, obviously there's a couple of different areas that we need to talk about. One of the touchy subjects, I guess, that may come up from now and again is labiaplasty. Let's talk about that to begin with.
You know, we have seen a tremendous increase in labiaplasties over the last 7 or 8 years, I think. And there's a lot of possible reasons for that. But the biggest thing I think to know is that most women do it because they're uncomfortable with the labia and their genital region. Usually it's because of fullness of those, the non-hair-bearing lips, the inner labia minora. They may get in the way in intimate situations. They may be difficult to ride a bike. I've had women talk about that just wearing a bikini. They feel like they have to tuck things on the inside because you can see the fullness in a bathing suit.
Now, I mean,
yoga pants. I hear that a lot.
Yeah.
People feel like you can see it when I've got yoga pants on.
Right.
I think the other reason that, two other reasons that it's become more popular and people are coming and requesting it more often is the style now is to shave. So people are seeing what was kind of neatly covered before. And then the internet makes it much easier to research, you know, a little bit of a delicate subject. It's not quite as easy to be looking at labia pictures as it is to look at liposuction or tummy tuck. So,
and I imagine some ladies have undergone some sort of trauma as well during the birthing process. I imagine the doctors are fantastic, but I guess when it comes to, you know, making them feel comfortable and looking the way that they want them to look, it's probably not quite the same surgery that we're talking about.
It's a different factor, and that we do see women who post childbirth because of extra blood flow in the pelvis from the baby. That area gets stretched out and then doesn't go back, much like the tummy tuck. But oftentimes we have seen some very young women,
who have not had pregnancy yet.
Who have not had pregnancy. I had one 20-year-old come in with her mother, and her mother said this has been hanging out of her panties since she was 7 years old.
Right.
And I never said anything to her until she came to me and said, this is a problem.
And you were talking about off camera that there are differences between the two surgeries. Explain the difference in the labiaplasty to...
Well, people call oftentimes and ask about vaginal tightening, and call that labiaplasty because they don't really have any other term to put on it. So vaginal tightening is definitely different than labiaplasty. Labiaplasty is really either tightening up or trimming the labia minora, which are the inner lips that oftentimes hang down lower below the labia majora, and a lot of women don't like how that looks. Vaginal tightening is definitely something that would come in after childbirth. It's not something that we actually do take care of. It's more to tighten the muscles.
And that's something we typically refer patients to our gynecologic colleagues because there can be other things that have occurred with childbirth, rectocele, different things like that, cystoceles, that also cause some problems, some anatomical problems in the pelvis, which is beyond our scope of expertise. So we deal pretty much with more the external on the outside, and we deal with the labia minora. We sometimes deal with the labia majora. Even the hair-bearing lips can sometimes be emptied and need fat grafting and filling back up or need skin removed. We also deal with, a lot of women have extra skin over their clitoral hood that hangs over the top. And that's something else that we can address.
Well, I mean, a touchy subject, I guess, for some, but a very important one. I'm glad we've covered it in this series. And we'll definitely be back to talk about some of the other procedures that we can get you guys to do. Thank you so much again to Dr. Gingrass and Dr. Haws for the Plastic Surgery Centre of Nashville. We'll see you guys again very soon.